August is National Hair Loss Awareness Month. Nearly 80 million people across the U.S. are dealing with hair loss, including both men and women. Joining me this morning is Dr. Natalie Hone, a dermatologist with the Skin People, to talk about some common causes. So does it equally affect men and women both?
It can certainly affect men and women. You do see more male pattern hair thinning or androgenetic alopecia in men, but women can also have female pattern hair thinning.
Okay, and so I assume that a lot of women also want the treatments because, you know, women are their identity is so tied up in their hair. So what would be some reasons that women experience hair loss? What would be some treatment options for them?
Absolutely. So the first thing is there's a lot of reasons for hair loss. So getting a correct diagnosis is key. The most common one that is seen, commonly discussed is the female or male pattern hair loss, and that's a genetic type of hair thinning. Nothing we can do about genes. We can't really change those genes, not yet, but there are things we can do to improve the quality of the hair or to halt the progression of the hair loss if that is your diagnosis. But really there are other types of hair loss. There are diagnoses of scarring type, immunologic type of hair loss. So those types of hair loss we need to diagnose correctly because there's amazing treatments we could do as dermatologists for that.
Mm-hmm. And are the treatments the same for men and women?
For female pattern hair loss, male pattern hair loss, there's some that are similar. One of the easy ones to consider is over-the-counter minoxidil, brand name commonly called Rogaine. Yep. So that can be done for men and women, and it works very well.
It works?
Yes.
Okay. I'm sure people have some skepticism about something that you could buy over the counter. That seems too easy.
It does seem too easy, but it's wonderful. The data behind it has been out many, many years, and it works extremely well. It helps get more blood flow to the area, dilate those blood vessels, get all of the good stuff to the hair follicles so they can grow thicker, and halt a little bit of the progression. And
is that what you would suggest for the most cost-effective way of treating this?
Yes, I think for specifically that diagnosis, that's a great way to start. I love it when my patients come in and they tell me, I've already started this Rogaine or minoxidil, and then if it hasn't worked as well as we want, then we can go ahead and move forward to
advance to the next steps.
Absolutely.
Which are what?
So depending, again, on the diagnosis, but let's talk about genetic type of hair thinning, right? Female pattern, male pattern hair loss. There are medications, there are pills that can help. For men, there's one that women cannot take, but there is one for men, commonly known as finasteride. That can also absolutely help hair thinning. And then there's actually oral minoxidil, same ingredient that you do for Rogaine. You can take it as a pill. That can be done for men and women. We have to make sure it's not going to interact with other conditions you have, but that will absolutely help. There's been a wonderful newer study out there that shows the benefits of it.
Yeah, if the shampoo isn't working though, would the pill work better?
Yes.
Okay.
Yes, the pill does work better.
And what about then if the pills don't work at all, are there surgical options for hair loss?
Yes, so there's a couple. What I usually recommend patients is start with topical therapies. Oral medications would be next step. I always recommend complementary therapies. That means things like red light, like improving quality of shampoos, like supplements. There are vitamin supplements.
Like biotin?
Biotin is a good one. We do a workup where we check vitamin levels because most common cause we see actually is vitamin D deficiency. A lot of us
Which is super common.
Super common, and it's a huge thing that you need for adequate hair growth. Iron levels in women, a lot of women have lower iron levels.
Also common.
Improving that. So there are specific supplements for hair loss that can be really beneficial. So that's a complementary. But then, extra things that you can do just depends. If you're not getting better, you can absolutely consider surgery.
Yeah, okay. And so talk a little bit about the surgical options.
Right.
How many are there?
So implants, hair implants, right? There are different techniques to do it. You would have to be evaluated by the appropriate physician for this to see what is going to be the best type. Not every type of hair loss is a good type of hair loss for this condition, but the genetic type that we discuss is good for this. And what they do is they put hair on areas where you've thinned out your own hair, and it's going to grow very well after you do it.
So they can take hair from the back of the scalp and put it up on top of the scalp?
Yes.
Okay, and is that good for both men and women?
It can be, yes, absolutely.
Okay, and the other more invasive option would be what?
Same, but it just means there's different techniques. So some of them are like little chunks of hair follicles are put there, and others are like strips. So it's going to depend on what type of hair loss you have and if you're a good candidate for it.
And in your office, you can do platelet-rich plasma?
Yes, so that's one of the complementary therapies that I think is wonderful.
You would do that in addition to something else?
In addition, usually for patients that are on a topical or on an oral, we can do platelet-rich plasma. We draw blood, we get the platelet-rich plasma, which is wonderful, filled with growth factors that are going to make your hair grow thicker and better. You need a few sessions of it, but it works very well. It's your own, platelet-rich plasma, so it's very nice. It has worked for many other things, joints, but we see for hair thinning, it's a wonderful addition.
Yeah. PRP and like stem cells. Do you ever talk about stem cell use for hair loss?
I think PRP is one of the better options for this. There's much more data, so we're really happy with those results. Another complementary that we add with the PRP is red light. Red light is easy to do.
Dermatologists always love red light. What's it doing?
Red light is great. It decreases inflammation, which a lot of people actually have inflammation of the scalp too. So we want to get rid of that. We also want to get the right blood flow to the area, which red light will do. We want to improve the energy, the ATP that the hair follicles have, which you can do with red light. So just other complementary things. There's so many things out there for hair loss. As long as we have the right diagnosis, we can guide you.
And if they come to you, they get the vitamin workup. You can pair the vitamins with the shampoos and the topicals, and you might be able to just tell them what the best cocktail is for hair loss.
For their specific diagnosis. Yeah.
Nice. And is there an age range of people who are most affected by hair loss?
It depends on the type, but if it's the genetic type, it will start happening around late 40s to 50s.
Yeah, so not necessarily an older person's problem. Somebody who still wants their hair.
Somebody that still wants it, and we want hair all the time. It's really an important part of our identity. So, I have my 80-year-olds coming in, and we want to do something about it. And there's absolutely things. It's never too late, I tell my patients.
Well, I say of course because I'm assuming that a lot of people who want to do something about it are women, right? Like, do the men come in for treatments as often as women do?
We get a lot of men. A lot of men are interested in treatment, and I think it's the right thing to do. I just wish they would come a little bit earlier if possible. I love this month. It's so important to have this awareness. If we can get therapy early on, you can see huge results. So the earlier the better, and there's simple things that can be done.
So people do tend to wait a while because they assume there's nothing that can be done about it?
I actually think men wait a little bit longer than women, but yes, they tend to wait a little bit longer.
Yeah. So for the awareness month, last thing that we can say is, what would you say to individuals who are just maybe hesitant to talk to a doctor about this?
I would say, think of this as a medical condition too, right? You want to find solutions for your body, and there are so many things available. We have to determine what your diagnosis is, and we can do simple things, we can do natural things, we can do a little bit more aggressive things. There's always something to be able to be done. So it's important to get an evaluation. And
I'm assuming like a lot of aspects of medicine, things are advancing all the time. So maybe if something didn't work for you years ago, maybe there's a newer and better treatment out now.
Yes.
Even though I know you want people to start early, but
no, absolutely. Yeah. There's a specific type of hair loss called alopecia areata, became really popular recently, where you can have all of your hair fully fall out, and there was nothing to be done before. And recently, there's new biologic medications that have shown wonderful results. So yes, there's always hope. There's always something that can be done.
Still talk to a dermatologist about this.
Absolutely.
Excellent information. Dr. Natalie Hone with the Skin People in Bel Air, thank you so much for joining me.
Thank you for having me.